Now, with gene association studies and genome-wide linkage analyses, it was found that there are 9 common loci likely found in vitiligo and autoimmune thyroid disease susceptibility. Also playing a role in the pathogenesis is a single nucleotide polymorphism of the PTPN22 gene. It encodes for a lymphoid-specific phosphatase involved in both vitiligo and thyroid disease. In certain studies, it was found that the majority of the serum of vitiligo patients had a presence of anti-thyroid hormone antibodies, and being positive for these would mean and suggest that it plays a role in vitiligo pathogenesis. Along with that, one's metabolism in general slows over time, so the thyroid gland experiences functional changes as one ages, which also increases the risk of thyroid disorders.
So vitiligo also has connections with diabetes. Studies show that the development of type 1 diabetes increases the risk of other autoimmune diseases such as vitiligo. There is also evidence that vitiligo precedes type 1 diabetes. About 16 to 20% of vitiligo's patients develop type 1 diabetes. Deficiency in the ATXN2 gene, which causes abnormal metabolism of sugars and fats, appears in both type 1 diabetes patients and vitiligo's patients. Vitiligo's patients with type 1 diabetes are at increased risk in developing other disorders such as AITD and gastritis. Vitiligo is also associated with other conditions such as pernicious anemia, which is categorized by gastric parietal cells, which are needed for intrinsic factor production. They are destroyed in the stomach, leading to a deficiency in vitamin B12, which is needed for red blood cell development. Vitiligo and pernicious anemia share a gene, but pernicious anemia is more common in people without vitiligo. Alopecia is characterized by patches of hair loss due to inflammation around the hair bulbs and the dermis. It is similar to vitiligo in that they have similar immune cells attacking the skin, which are the T cells with CD4 and CD8 cells. And lastly, Addison's disease is categorized by the insufficient amounts of cortisol and aldosterone hormones produced by the adrenal glands. This causes hyperpigmentation as well as vitiligo. Hyperpigmentation is the darkening of the skin, while vitiligo is the lightening. This is the result of increased production of adrenocorticotropic hormone and melanocyte-stimulating hormone, or MSH, to compensate for the insufficient cortisol and aldosterone hormones. So for the treatments, it depends on the age, location, amount of skin affected, speed of development of the disease, and how the disease is affecting the patient's life. There is no definitive cure for vitiligo, but there's methods to treat it and return pigmentation to the skin, and they include medication, therapy, and surgery as the last resort. So for the medications, we have the corticosteroid creams, which control inflammation to lessen the damage to the melanocytes in the epidermis. Currently, this is the most effective treatment for treating vitiligo. Pills or injections can be prescribed for rapidly developing cases. Calcineurin inhibitor ointments such as Protropic or Elidel affects the immune system to inhibit the overacting immune response in order to protect the melanocytes. This is the most effective for cases with small areas of depigmentation, especially on the face and neck. So for the therapies, we have light therapy, which is introducing a narrow band of ultraviolet B or UVB light to the affected areas, and it has shown to stop or slow the progression of active vitiligo. It is more effective when taking the medications listed before, but the risk of skin cancer while taking the calcineurin inhibitors is significantly significantly increased because the immune system is inhibited. Another therapy is the combination of Solarin and light therapy. This can return pigment to the skin by ingesting or applying the Solarin to the skin and being exposed to the UVA light, not the UVB. This is effective, but it is also more difficult to administer than the traditional light therapy, so it is slowly being replaced. And lastly, depigmentation of the skin. If other treatments were ineffective, depigmenting agents can be applied to the unaffected areas around the vitiligo-affected areas to lighten the skin tone to make the areas less noticeable. And lastly, we have surgery. This is usually done as a last resort. First, we have the skin grafting, which is transferring pieces of unaffected skin to the affected areas. Second, we have the blister grafting, which is creating blisters on unaffected skin and transferring the tops of the pigmented blisters to the affected areas. Both of these methods would obviously cause scarring and can result in a blotchy looking skin. And lastly, we have cellular suspension transplants, which is cells from unaffected pigmented tissue is taken and suspended in solution and are transferred to the affected areas to grow and produce pigment.
Many societies hold appearance to be important, to a point where it can affect one's status and call for prejudice is most uncalled for. Since vitiligo is a cosmetically disfiguring disorder that can visibly affect those who have it, these depigmented patches can make people feel undesirable or not within what's deemed beautiful, thus resulting in a decreased quality of life. Oftentimes, it was found that patients with darker skin that had vitiligo all had depressive disorder, social phobias, and a higher risk of suicide. Other observations included that factors of depression and suicide decreased as one's socioeconomic class increased, and also that vitiligo in children had long lasting effects on their self esteem psychologically, pertaining to their anxiety that comes with interactions and depression.
Historically, vitiligo was often confused with other diseases or of being a curse, condemning the individual to have depigmented skin. The earliest record of vitiligo was in 1500 BCE, where the disorder was referenced in the Rig Veda as a disease called Kila, which translated into the white-spotted deer. Also in 1500 BC, the disease was called white leprosy in the Ebers Papyrus. The disease was commonly confused with leprosy throughout history, condemning those with the disorder to be social outcasts, as those with leprosy were seen as unclean and had a contagious disease, though we now know vitiligo is not contagious. One culture that did not discriminate towards those with vitiligo was ancient Korean cultures. In 1400 BCE, the disease was referenced in the Athara Veda by the name of Sveta Kushta. In this example, the disorder was thought to be a curse inflicted on those who were gazed upon by an illegitimate child. In 1 AD, the disease was finally named vitiligo in literature. Though it now had a name, the stigma still surrounded the disease. It would take several advances in medicine to fully understand what the condition was. In 1533, the skin was found to be composed of two layers by Andreas Vesalius. In 1665, skin color was theorized to originate from a layer of the skin that would later be named the stratum basale. In 1837, pigment was found for the first time in the epidermis, and a lack of pigment was found in vitiligo patients in 1879. However, despite the condition being something the individual could not control, those who were afflicted were often the subject of discrimination, ridicule, and even were forced into freak shows, where they were put on display, such as the boy in the photo being labeled a freak of nature. Recently, there have been positive strides to bring awareness and normalcy to those with vitiligo. There are now toys, such as dolls, being created to show differences in skin, including those with vitiligo. There is more representation in the media, such as cartoon characters and actors proudly displaying their unique skin. Recently, a popular video game known as Animal Crossing allowed users to customize their skin pattern, making it the first game to have a customizable representation of vitiligo. There are now a number of support groups connecting those with the condition to boost their confidence and find pride in their beautiful and unique appearance.